Welcome everybody to our M2M today. I'm Annalisa Zuccotti. I'm in charge of communication and events here at BioRen. And today I have the pleasure to have here in our office Andreas from Singleron. And welcome here. Please shortly introduce yourself.
Sure, thanks a lot. Thanks a lot for the invitation. It's always great to be here. And I'm excited to share with you a bit about Singleron. So I'm Andreas Schmidt. I'm the Senior Vice President of Business Development at Singleron. I'm a biologist by training, spent a lot of time in California working on immunology, then moved to Singapore, started two companies from there that you will hear also a little bit later about. And then now at Singleron, I'm responsible for anything that's really clinical pharma. That's this triangle of working on translational research and creating real impact for patients, pharma companies, and all other stakeholders.
Yeah, thank you. So, Andreas, if you've seen already our first M2M, you know that we have a icebreaker question for you. I have here two jars, one with M&Ms and one with Haribo. So which one, which type are you? Would you take chocolate or gummy bears?
I'm a gummy bear fan, so I'll go with the gummy bears.
Okay, perfect. So this, you can bring it back then to the office and share it with your colleagues. Yeah. Perfect. So I've seen here we have maybe a colleague of yours.
Yes, maybe our most famous colleague, Simon Singleron, I brought with me, and he will actually stay with you here as our ambassador at BioRen from Singleron.
Okay.
So hope you will become good friends.
Yeah, great. We will put here in our trophy area. Cool. Perfect. Thank you very much. So I'm going through some question with Andreas, but obviously you are listening to the interview from your office or your home office, wherever you are, you can also post some questions in the chat and we will address that to Andreas in a few minutes. So let's talk about Singleron from your perspective. So we know that actually your journey at Singleron started with Proteona, so a startup. So tell us a bit more about that. When was it founded? What was the vision at the time?
Yeah, so interestingly, both companies, Singleron and Proteona, actually got founded around 2008. So they're roughly the same age. And both of them actually have a very international background. If you think about Singleron, it was started by the current CEO, Nanfang, as well as Rongfang, who's a very actually distinguished professor and international key opinion leader at Yale University. And then later, actually, Singleron moved to a lot of operations in China and is now actually very active in Europe. And I think there are a lot of similarities also what Proteona actually had started with. So Proteona started in Singapore, and then we were very active here in Germany as well as in California. Both companies focusing on single cell analysis and making single cell analysis more accessible, easier, and particularly also creating large impact on single cell data to real clinical implications in pharma, in patients and clinics. And I think that's what drove both of us, probably from slightly different angles. I think Singleron is a great platform that has everything from devices to kits to service around that. And Proteona focused much more on clinical indications.
Okay, so exactly digging a bit in this topic. So more or less 1 year ago, the news that Proteona was acquired by Singleron came out. So would you like to tell us a bit some background, so the rationale behind that? What did you see at the moment? Why was a good point to be acquired?
Well, we knew each other actually for quite a while. And I was in touch with Nanfang, the CEO and founder of Singleron. And we always thought, actually, we are very close. We are in the same area. We think very much alike. So how could we actually partner? And then I recall actually a call like a bit more than a year ago. That was just a short call where I think it was an eye-opener for both of our sides. The best way to cooperate is actually if Singleron is buying Proteona. And I was surprised, I think after the first 30 minutes, we were both actually set to make this happen. And I think the synergy here is clearly that Singleron has a very broad range of tools for single cell, well established. And we had very interesting applications in multiple myeloma and other disease indications. And I think it was just a logic 1 + 1 is far more than 2.
Okay, perfect. And 1 year after, I mean, how did it work out as you imagine? What is something changed? Is there a new vision, or you are still on?
I think that the core of what made all this work stays exactly the same, from single cell to precision medicine. And I think that's like what both we, like I think all of us in the company can undersign. Obviously, it's a really adventurous journey as a small company to become now part of a larger company that's growing, that's very expanding into different disease indications, having a lot of new products. And that journey, I mean, it's a once in a lifetime experience, I think, for everybody, and it's really cool. I think we stayed true to the core of what we want to achieve, and we just think about this now in a much bigger vision, making sure that we can actually handle multiple products, multiple customers, from very small ones to big ones, and also projects in different disease indications. And that is, I think, super exciting, and I think that's where the future of medicine really is.
Yeah. Perfect. And I mean, now is definitely my point to dig a bit more into the product, what Singleron Biotechnologies can offer, and maybe on the first moment, on a with few words, in few sentences, how would you describe the unique selling point of Singleron? So give us an appetizer.
I think uniqueness for us as a company is that we can basically cover everything single cell from early to late stage. But let me give you a few examples. Focusco is a product where you can dive deep into a very specific low prevalence RNAs. Product from us. Or Dynascope, I think it's a really cool way to look almost in a pulse chase way of like how markers are incorporated actively in RNA. So it's basically a live view on RNA on a single cell level. And then, I mean, I think we are very big in multi-omics, so combining genomics and proteomics. And that means we have a lot of projects on the bioinformatics side and a lot of tools that actually fit well to that. And I think this multi-omics view on clinical indications is something that's very new, what we bring to the table.
Perfect. So I know that some of your colleagues wanted to give us an impression about the lab, about the products that you have, and they recorded a short video. So now we will watch that. So thank you, first of all, for recording that. And yeah, let's see Singleron and not only hear about it.
Absolutely.
Hello, welcome. So hi, my name is Anukra. Welcome to Singleron Biotechnologies, and here I work as the Business Development Manager. At Singleron, we live by the motto from single-cell multi-omics to precision medicine. And here we try every day to overcome the limitations of the state-of-the-art of single-cell analysis. And with our end-to-end solutions, we open doors to novel approaches for clinical research and molecular diagnostic. Today, I would like to take this time and show you a bit around our company. We can take a look around the labs and see if we find some colleagues who are working there and if they have some time to tell us a little bit about their work. So please follow me. Come in. Hello.
Oh, hi.
Hi, how is it going?
Pretty good.
You seem to be pretty busy, so we won't take much time. Would be great if you can shortly introduce yourself and tell us a bit about this cool-looking machine.
Oh, hi. Hi, I'm Aati. I'm a lab technician, and this machine is the Matrix.
The Matrix?
Which basically loads our chips with beads and cells and reduces our hands-on time.
Okay, and what's the main application or what's the main job of this machine?
Well, we have a device called our scope chip, and we have also our adapters, which we basically put together in the Matrix, which loads our cells into the microchip as well as the beads.
Okay.
And provides us with the suspension combined with the beads.
Okay, so this is a, so to say, automated process.
Exactly.
Perfect. Great. Thank you.
Sure,
Have a nice
you're
day.
welcome.
Bye.
Bye.
Okay, hi, welcome back. We just spoke with our two colleagues in the lab. Now let's walk in this direction and see if we find some other colleagues. There you are. Hi.
Hi,
Hello.
how's it going?
Good,
Well,
good.
Or good?
Yes, yes,
Yeah.
absolutely. Sit down.
Yeah, sure.
So, can you shortly introduce yourself and tell us a bit about your role at Singleron?
Sure, I can do that. So I'm Pedro. I'm a sales manager here at Singleron. My role in the company is, of course, to bring single-cell sequencing solutions to our customers. I am currently responsible for different areas in Germany and also Benelux countries, and my team also covers some parts of Germany as well. So, for example, East Germany, Berlin.
Okay.
So this is normally how a sales team is structured. You have
Okay.
different people covering different areas.
Yeah. Yeah.
We manage current accounts and also try to identify new customers which could
Right.
benefit from our single-cell sequencing solutions.
Right.
Yeah.
That's great. That's great job. So, this is my colleague Pedro.
Yeah.
He with his team, they're working on bringing single cell solutions to our customers who can clearly benefit from this cool technique. So thank you, Pedro, for your time.
Thank you as well.
And thank you everyone for listening to us, and enjoy the interview. Have a nice day. Bye.
Bye.
See you.
Okay, perfect. It was very nice. So maybe some of you have recognized, so Anuga is also often at our lounges. So it's also an occasion for you, if you want to talk to Singleron, to join the lounges, for example, and talk to him. But I know also that this afternoon you are available for some one-to-one chat. So
Sure.
a link will be posted in the comments, and this can be, you can dial in this meeting and talk directly to Andreas and to the colleagues. But the interview is not yet over, so don't misunderstand me. So actually, we are just at the beginning, and now we are ready. After this video, after seeing already machine, a product, maybe if you want to dig a bit into the scientific background and tell us a bit more about the potential.
I love to talk about the beauty of the science behind it. And probably you saw already, like in the corner, our chip. Single cell is super complex. And I think a solution that is like very simple makes it very, very elegant. That's great science, but I think it's also very, very useful for users. So the core invention of actually everything what we are doing is this chip. If you would zoom in, you would see there are a lot of microbells. It's a bead-based technology enabling you to create your own libraries for single-cell sequencing. The special thing there is you can use fancy machines. You saw that just the matrix. We have a lot of solutions actually for optimizing it for customers actually with a very high throughput. But we also have very good solutions if you just want to get started. So this chip, if you have a pipette, you can start entering your own journey into single cell analysis, which I think is amazing. I'm happy to give you one.
Okay, we don't have pipettes here, and unfortunately, although
we will get you a pipette.
Okay.
But seriously, if you're a PhD student, if you're a postdoc in the lab, you want to get started with that, I think we provide a solution for that. If you're a big pharma company and actually think much bigger, we will also have a solution. And I think that's pretty cool for a complex area like that.
Okay, perfect. And yeah, so you've already mentioned this peculiarity from Singleron and your vision to bring together pharma, clinic, patients to make innovation happen. And I know that since a long time you are bound to the innovation ecosystem. So okay, now the labs or the office are in Cologne and worldwide actually, but you come often to Heidelberg. So why? What is special here in Heidelberg?
Well, I think we have been a partner in Heidelberg, it feels like forever. And I think it's a unique actually setting where you typically bring together clinic, pharma, and startup, which is this like magic triangle to make things move with impact. And I mean, probably I can tell like one little story. I was presenting here at actually one of your events, the Business Development Conference every fall. I was presenting a story on multiple myeloma on single cell. And afterwards, a representative, a manager from a pharma company, AbbVie, I think I'm even allowed to mention them, came to me and said, hey, this is great. Why don't we work together on Alzheimer's? And I said, hey, you didn't listen. I was talking about blood cancer. And later he explained to me why that's a perfect fit for what they want to achieve. And then very quickly we found another partner, Siomics, also a company, small startup out of DKFZ, that is also working around here, very active partner. And this triangle actually was a very, very good work over the last few years. So together we approached actually a very complex heterogeneous disease like Alzheimer with multiple tools combining proteomics and genomics. And that's beautiful science. And later this year, actually, we will reveal much more about that. But I think it's also a great friendship of people liking to work together. And I think all this comes together in Heidelberg. So obviously we are a fan, we are active partner, and we will be back all the time.
Okay, perfect. So I promise that we did not put these words in Andreas' mouth, but this is definitely fitting also Bayer and vision. And I'm so happy that, you know, here we have a concrete example of our mission. So we do many activities, we have working groups and so on, exactly to achieve the benefits of patients at the end, and cooperation like this are just very much welcome in the region. Yeah, so maybe you can now take this occasion also to make a call. So which kind of partnership would fit well? So which kind of partners are you looking for? Who could be the next cooperation triangle, as you mentioned?
Yes. So I think we are very open to partnerships. We have, I just mentioned one, we have multiple partnerships here on campus and around. Typically, our starting point is looking at complex heterogeneous diseases, something where you think, okay, these cells are very different, they are very diverse, and it really justifies to have a deep dive into it. And it can be as different as, like, I mean, the example I just mentioned, Alzheimer or oncology, which on the first view don't have anything in common. Typically, we love to have very hard problems from clinician scientists. So things where with the current tool sets, you can't answer these questions. And I think in the next step, then we look at, are we just a partner? Is there interest from a pharma company? Is that something where it's basically like a product would solve that, and we are happy actually to help you actually to find the right product that is exactly doing that? But we really are interested in also moving customers to long-term partners. And we can do that in consortia in various ways. And I'm happy also later in our additional actually interaction hour to share a few more examples depending on your interest of how we can be of benefit to partners and colleagues here.
Mm-hmm. And so if you would look to your current cooperation that you have ongoing, is more cooperation with academia, with clinics or pharma, or is always a mix?
I think it has always a clinical aspect in the back. Mm-hmm. I think that's also what drives us as like not just the company vision, but all of us individually. We want to have impact on patients. Mm-hmm. So sure, we can support academic research, but typically single cell, I mean, takes some resources. It's an expensive, demanding technology. There's a lot of things that you don't see, like complex bioinformatics, which takes resources. So if you want to justify using all these resources, it should be a question that you want to address that really matters. Mm-hmm. And then, I mean, we are very broad. I think a lot of people actually are amazed to hear how many different samples we have processed. It's more than 400 right now. So literally every tissue, we have some experience, and we also venture out into like more unique things. I mean, so not just the normal human tissues that you might associate with like the major cancer indications, mm-hmm. But we also have experience in mouse work, in various other animal work, even in plant work, in yeast work. And recently we got our first samples back from space. I'm sure that's another story we'll unravel later on. And also if you think about other biological projects, from beer to wine, we actually will soon show how single cell actually can even contribute inside to areas like that. So there are lots of new stories coming out soon from us.
Okay, very nice, interesting. So maybe now we can play a small game, to complete a sentence. So with one word, or let's say a few words. So the first sentence would be to shape the region into one of the world's strongest biotech cluster. We need more.
Well,
one word.
Yeah, I'll give two answers. The first one is unfortunately boring. It's money. I think, as always, money is important to foster biotech, and like all these things are expensive. And I think there are also some great initiatives here around, and we, of course, as Singleron, also play our role in investing in what we are doing. I think the second thing is clinical data. And that becomes more and more important. It's probably one of the biggest trends in the industry, being clear of like what clinical data can be used in what ways. And also we as Singleron create a huge amount of data. If you think about it, typically we look at 10,000 cells in each sample. Then you have 2,000-3,000 mRNAs. You have additional proteomic data. You often aggregate it with other data. So having good ways how to commercialize that, how to share that, how to move that also into like companion diagnostic, patient stratification is something where we see we can be a major partner, having very high quality data in these kind of consortia.
Okay, perfect. So if we shrink it back to one word, it's true, clinical data.
I think so, yes.
Okay.
And I mean, it's great that there's a new initiative also from BioRN focusing on that topic. Yeah. I feel I almost make advertisement for BioRN, but
it should have been the opposite, yes. Actually.
But I think actually that hits really the spot. I think that's one of the most important things of what we should do right now. And we are glad to be partnering that.
Okay, perfect. So also about this, stay tuned. It's really this month will be released a position paper on the topic where different parties here in Heidelberg came together and discussed about it. Yeah. So the next question is, the future of biotech will be?
The end of cancer. I mean, if you want to strive for goals, you should actually reach to the stars. I think cancer at some point in our lifetime will be a manageable disease. And I think single cell analysis will play a major role in that. Understanding the complexity of all these different cell clones, being able to follow them before and after every treatment, and then actually having targeted therapies to that. And I think the information how to target cancer specifically will be a major puzzle piece there. And we will play our role. And this will be also our commitment to stay in this game to make this happen.
Great. Last sentence, the hottest biotech topic in 10 years will be?
I think I hinted on it already. I think the biggest trend that we see is this data science and life science moving together. And I think that affects everything of what we are doing. Hard for me to say more there. I think that's the process that started a few years ago. And now we are really able to make precision medicine, personalized medicine, a true, real thing.
Yeah, perfect. Liked very much your 3 words. Then we are moving a bit now from the company, a bit to your personal vision. And I mean, we have heard already a lot of personal vision, but more on personal question. So tell us how one of your typical days look like.
I think it always starts with a cappuccino and a travel around the world then. So, I mean, we are a very international company. I mean, we are very active in Germany, across Europe. We are very active in Asia, no matter if it's Singapore, if it's China. We have colleagues in the East Coast and West Coast in the US. So often it actually starts with going through actually one-on-one or like small group chats with various people. Like often the day starts in Singapore, for example, where I have close people considering the time zone, moving then to my close partners and associates in Germany, and then later on moving to California. Yeah. And now I think after Corona, this is actually often very virtual. But I think me, as well as a lot of my colleagues, are often also on the road, which I think is a great way how to work now in a after Corona world. And it's actually quite exciting. So I do like to travel. I do like to still meet people, and that's completely worth it to make actually great projects happen.
Yeah. So you were mentioning before, Singleron is in different time zones. Your time zone is worldwide, as far as I understood. So it starts. So you cover the entire sites.
I think if you address major questions, major diseases, if your market is research, your company is international, earlier or later. And we are very committed to that. And you see that also in the office culture, how diverse the background is, how many nationalities we have actually covered in the team, and how people work together.
Have you counted them?
I think there's a statistics. I think we also have internal statistics actually where our customers come from.
Okay.
And we cover like any spot with life science.
Yeah, will be nice to see them. And so you travel. If you're not traveling physically you travel a lot also during your call, but if you're not working, if you're not traveling, where can we find you?
I mean, I'm a big outdoor person, so anything from climbing to canoeing to skiing is something I love to do. But often actually I feel that like my occupation and my hobbies actually merge. I love to actually visit biotech clusters around the world. So not only Heidelberg and Bahrain, but also looking at how does life science work in Reykjavik, in Taipei, in San Francisco, in Boston, and what can you learn from that? And is this now work or hobby? I think it's great if you have things where you can't even tell.
Yeah, nice. Perfect. So thank you, Andreas, for coming to Heidelberg. Thank you to your colleagues that prepared the video. As I said, you have all the opportunity to talk to Andreas, not only this afternoon, but we will share also the contact details, set up a meeting, meet him at our events and so on. Before closing this session, you have the opportunity to nominate the next M2M. So who would you like to see here?
I have a particular vision, the particular nomination, and I hinted on it if you listened carefully. I would love to actually nominate two people, two groups, which is Siomics and AbbVie. I think they should find it out who is the next. But I think the great partnership we had in the past really stands for what makes BioRN great. And I would love to see actually both of them in this format here.
Yeah, perfect. Thank you very much. So the gummy bear jars, you can take it with you. You have been M2M by BioRN.
Thanks a lot.
And yeah, we have already a next appointment for M2M. So it won't be AbbVie or Siomics. This needs a bit of organization time. But next on the line on April 20th is Progen. So we will stay in Heidelberg and we visit them. Again, April 20, so you can already mark your calendar. You will receive an invitation soon. And yeah, thank you, Andreas, once more. Thank you, Singleron. Thank you to your colleagues.
Thanks a lot. And I mean, one of our colleagues actually stays with you, so we are always here.
This is mine. Perfect.
Thank you.
Thank you.
Okay.
Bye.
Bye-bye.